Welcome back. In the ENT series, we are going to discuss about hoarseness of voice today. We'll be dealing with the definition, causes, clinical features, and investigations of hoarseness of voice. Definition: hoarseness is the roughness of voice. It is resulting from the variations of the periodicity and intensity of consecutive sound waves. So, to understand the definition, you need to know how the normal sound is produced and who is acting on it. So, this is the larynx, which is given in the green. The larynx is also known as voice box. It is because it contains the vocal cords. These membranes, which are given in the white, are the vocal cords. These vocal cords are made up of mucous membrane. They open and close. So here in the picture they are open. When they close, what happens? The air gets trapped below it and it will create a pressure which will produce the sound waves. So you see, whenever they are closed, it creates a pressure and these open and they produce sound waves. So there is an alteration in the intensity and also in the, you can see here, periodicity. So whenever there is an alteration in the intensity and periodicity of these consecutive sound waves, it results in a roughness of voice. So what's hoarseness of voice? Hoarseness of voice is nothing but the roughness of the voice resulting from the variation in the periodicity and intensity of the consecutive sound waves. Hope it's clear. Causes of hoarseness of voice. Starting with inflammation. Inflammation could be acute inflammation or chronic inflammation. Acute is acute viral laryngitis. So you see, laryngitis is nothing but the inflammation of the larynx, which contains the vocal cords. So whenever there is an inflammation of the vocal cords. Diphtheria. Guys, what happens in diphtheria? It is a contagious bacterial disease. It will cause the inflammation of the mucous membrane. It will form a false membrane in the throat, which results in hoarseness of voice. You can see this thing. What it will do, it will create this throat. It will create a false membrane in the throat. So the production of the voice won't be normal. It will cause hoarseness of voice. And then in whooping cough, what happens? The whooping cough, also known as pertussis. It is also a contagious respiratory tract infection. It causes a severe hacking cough. When there is a severe hacking cough, what happens? It will result in hoarseness of the voice. Then you see the chronic inflammatory causes. Chronic laryngitis, the inflammation of larynx for a long period of time. TB. In TB, what happens? The TB of the larynx is very rare, yet the patient will present with hoarseness of voice. Syphilis, leprosy, fungal infections. In the infectious diseases like leprosy, syphilis, the vocal cord involvement will vary and it will depend upon the hoarseness and difficult breathing will be there in them. Okay. These are the inflammatory causes. It could be acute or chronic. Under acute viral laryngitis, diphtheria and whooping cough. Under the chronic inflammatory causes, chronic laryngitis, TB, tuberculosis, syphilis, leprosy and fungal infections. Okay. Neoplasm. The second cause, neoplasm. Neoplasm could be a benign neoplasm, a pre-malignant neoplasm or a malignant one. Starting with the benign one, papilloma. So guys, you can see the papillomas are a wart-like growth or it is a tumor on the surface of the voice box. What do? They will cause a damage to the vocal cords and they also cause a problem in breathing. These papillomas, okay? Then you see the hemangiomas. The hemangiomas, what do? They are benign vascular tumors and they also cause the hoarseness. Then they are talking about chondromas here. These chondromas can also cause a damage to the vocal cords resulting in hoarseness. Then you come to the pre-malignant causes. It is leukoplakia. Leukoplakia is nothing but a white patch like a lesion that forms on the surface of the vocal cords. Here you can see here they have given in the picture the hemangioma and the leukoplakia on the tongue. The same these white kind of patches will be formed in the vocal cord. Then you see the malignant cases, cancer and sarcoma. So you can see the papilloma here, and these white lesions, when they are formed on the vocal cords, it is known as leukoplakia. Then they are talking about papillomas, hemangiomas, chondroma, and malignant will be cancer and sarcoma. Hope the neoplasms are clear and you know what each term defines: a papilloma, hemangioma, chondroma, and leukoplakia, cancer and sarcoma in malignant. Then you see the non-neoplastic lesions. They are vocal nodules, vocal polyp, contact ulcers, and cyst. So the vocal cord nodules, they are also known as singer's nodules, and they are also known as screamer's nodes. They appear on both the sides of the vocal cord. A vocal polyp will usually occur on one side of the vocal cord. With this you can differentiate the vocal nodule and a vocal polyp. Both will be formed on the vocal cord, but this nodule will be formed on both the sides. Nodules on both the sides of the vocal cord. This is the vocal cord and they will be formed on both the sides, whereas this vocal polyp will be formed only on one side. Polyp on one side, nodules on both the sides. With this you can differentiate. Then you see the contact ulcers. You can see the ulcers which are starting in the mouth. They can go on ending up in the larynx. Contact ulcers, and they can affect the vocal cord. Cyst. The vocal polyp is given here in the picture. Okay. Then we see the trauma. Forceful shouting, blunt and sharp laryngeal trauma, foreign body, and intubation can also result in hoarseness of voice. So you know the forceful shouting, you go to like a stadium, you shout there, you cheer a lot, and then you come back and the next day you're having hoarseness of voice. So the forceful shouting, blunt and sharp laryngeal trauma, a foreign body is stuck in the throat, it can also result in hoarseness of voice. Then they're talking about intubation here. So guys, intubation, how is intubation causing hoarseness? Intubation will create a pressure on the walls of the larynx. It is caused by the endotracheal tube. This will result in the recurrent laryngeal nerve damage. Whenever the laryngeal nerve damage is there because of the intubation, the pressure by the endotracheal tube, it will result in hoarseness. Okay. Then you see the paralysis. Recurrent superior laryngeal nerve or both the nerves paralysis. You can see the left recurrent laryngeal nerve here. When these nerves, superior laryngeal nerve, recurrent laryngeal nerve, when there is a paralysis of these nerves, it can also result in hoarseness of voice. Then the next cause is fixation of cords. Arthritis or traumatic fixation of cricoarytenoid joints. Here they are talking about the cricoarytenoid joints. Whenever there is arthritis, inflammation or the fixation of the cricoarytenoid joints, then it will lead to hoarseness of voice. The cricoarytenoid joints I will show you in the next picture here. Okay. This is the cricoarytenoid joint. Whenever there is a fixation of these cricoarytenoid joint, it will result in hoarseness of voice. Okay. Then we continue. This thing is done. Congenital causes are laryngeal web, cyst, laryngocele, paralysis, and vocal sulcus. So let us deal with each one of them. Starting with the laryngeal web. Laryngeal web is a rare condition. In this, what happens? The windpipe will be constricted. It will limit the volume of the air flowing in and out of the windpipe, resulting in hoarseness. So the constriction will be there. You can see the laryngeal web, like a web-like structure is formed here. This web-like thing is going to constrict. There is a constriction, so it is not allowing the air to flow properly, resulting in hoarseness of voice. This is laryngeal web. Then the cyst formation. Laryngocele. Laryngocele is the abnormal dilatation of the laryngeal saccule. You can see the laryngocele here. These are the saccules, the normal saccule. You can see this very clearly they have given here. This is a small thin saccule. Okay, the normal saccule. Then you see to the laryngocele, the external compartment laryngocele and the internal compartment. What is happening to the saccule here? It is becoming dilated. This enlarged saccule is known as laryngocele. Paralysis of the cords, vocal cords, and then last thing is the vocal sulcus. So vocal sulcus is nothing but the groove or infolding of the mucosa along the surface of the vocal fold. You can see here the vocal folds, the membranous infolding of the mucosa. This mucosa is being folded here. A groove like thing is formed, so there is no much space for the pressure to be created and the production of the sound waves, resulting in hoarseness of the voice. Okay, this is the congenital causes: laryngeal web, cyst, laryngocele, paralysis and vocal sulcus. Systemic disorders: hypothyroidism. We see people having hypothyroidism. As the ages pass, the voice changes will be observed in them. Roughness of the voice, hoarseness of voice is seen. Sarcoidosis, amyloidosis. So the sarcoidosis is nothing but the growth of the tiny collection of inflammatory cells in the vocal cords. Okay, you can see here sarcoidosis. And then amyloidosis is the buildup of amyloid proteins in the different parts. This abnormal protein will be produced in the bone marrow, and this being produced in the bone marrow, it gets deposited in the vocal cords in different parts, resulting in hoarseness of voice. The picture is given here. Sarcoidosis, you can see here the abnormal inflammatory cells, collection of the tiny inflammatory cells. These which are found here can also be found in the different parts, resulting in hoarseness of voice. And the person having amyloidosis will also have the hoarseness, because a different type of a protein, amyloid protein, is being deposited, abnormal protein. Then you see in myasthenia gravis what happens, guys. In myasthenia gravis, there is basically what happens, there will be rapid fatigue of muscles. And first it will involve the other muscles, and then it also affects the throat muscles. Affecting the throat muscles, it will impair the speech. You can see myasthenia gravis, the tongue of the person here. These are the systemic disorders: hypothyroidism, sarcoidosis, amyloidosis and myasthenia gravis. So we know under each what's happening. In sarcoidosis, inflammatory cells will be deposited. In amyloidosis, a amyloid protein will be there, and myasthenia gravis. Now we move on to the clinical features. Clinical features: the voice is going to be weak, or there will be loss of voice. You see the severe hoarseness of voice, you speak but then your voice doesn't come out that clear. There is complete loss of voice, or there will be a weak creaky voice. Then stridor, the noisy high pitched sound. Drools more than usual, so drooling will be there. There will be trouble swallowing and difficult breathing. So we know the causes in what's happening here. Inflammatory cell deposition will be there, and then all the saccule will be enlarged. There will be paralysis or a sulcus formation. The cricoarytenoid joint could be fixed. The paralysis of the laryngeal nerve will be there, or the foreign body, presence of a foreign body, nodules, polyp formation, ulcers will be there, papillomas, hemangiomas, leukoplakia. All these conditions, what do? They result in difficult breathing, difficult swallowing, and along with that there will be fever. Okay, these are the clinical features. These causes will result in the presentation of weak or loss of voice, stridor, drools more than usual, there will be trouble swallowing and breathing, and typical inflammation. So whatever inflammatory diseases, the person presents with fever. Okay, then we come to the investigations. History: any hoarseness presenting for more than 2 weeks will deserve the examination of larynx. So what do? We examine the larynx if the hoarseness is present for more than 2 weeks. The indirect laryngoscopy, examination of the neck, chest, cardiovascular, neurological system to find the cause of laryngeal paralysis. Okay, all this is done. First we take the history. History should be taken if it is more than 2 weeks. Then we do the indirect laryngoscopy. Then examination of neck, chest, CVS, neurological system, and also we find the cause of the laryngeal paralysis. Then we move on. Laboratory investigations and radiological examination should be done. Direct laryngoscopy and microlaryngoscopy. You can see the direct laryngoscopy in the picture, and the last one showing the microlaryngoscopy. Guys, in microlaryngoscopy, it is nothing but a surgical procedure which will avoid the provider to view the vocal cords. So we can view the vocal cords with a microscope. Okay, the frontal view you can see here. You are able to view the view the vocal cords with the microscope. This microscope will help you to see the vocal cords. This is microlaryngoscopy. Then the biopsy of the lesion, assessment of motility of cricoarytenoid joints. So I have told you that the cricoarytenoid joints will be present here. Cricoid cartilage, arytenoid cartilage, joining both of these there is a joint, that is nothing but the cricoarytenoid joint. Bronchoscopy and esophageoscopy. They are talking about bronchoscopy and esophageoscopy. This is done to assess the lung there is some problem in the lungs and esophagus. Thank you. With this we come to an end of hoarseness of voice. Hope the video is clear. If you like my video, hit the like button and subscribe.